Because for all specialist practices that are done in LUTH, accreditation exercise take place from time to time. And we don't want to lose any of, because a number of departments, a number of members from various departments have raised fear that, so that they don't lose accreditation of their because teaching hospital services are specialized services. And when you are working, every member of the team is playing one specialized services or the other to make up the team.
Okay. Now, Doctor, anybody who saw that report will probably say, why did you all wait this long to start talking about it? Because the state of those toilets, the state of those bathrooms, I mean, they're enough to make anybody sick, not get well.
Thank you very much, Ma. That's a very important question. We didn't wait this long. This issue has been there for long. We have been talking about it. In fact, to be precise, on the 20th of February, we submitted a document to the management of LUTH and all the board members, about 40 pages, where all the problems were chronicled in all the departments, and we also provide solutions to those problems. So we have not...
Doesn't LUTH have a borehole? Or boreholes?
Well, there are boreholes in some places, but you can see the water situation in LUTH is nothing to write home about. Really, there are a lot of problems. Those documents we wrote, and we expected that the management will look into those documents and try to correct some of those things. Now, let me just be clear about something. The fact is that what we are saying is that we want LUTH to perform better in the interest of the patient, primarily, in the interest of the patient.
And the medical
and
students.
Also the students and everybody that is working there, because we are the one that treat these patients, and we are the one that face the challenges at the forefront. So we know what the patients are going through. So we have been complaining, we have had meetings, series of meetings, but well, the issue is that, let me just be very clear, LUTH management has their own issue, but there is also the aspect of adequate funding by the government of the Federation.
I'm glad you raised that. Yeah, I'm glad you raised it, because I was just about to interject to say that, do you have an understanding of the revenue generated and how much money was coming from the federal government to LUTH? Do you have an understanding of that as members of resident doctors within the university teaching hospital?
Okay, thank you very much. You see, when it comes to issue of money, finances that are available to LUTH, we might not be able to get the exact figure. However, we have an idea. Now, the issue is that right from the top, the percentage of the budget allocated to health is very low. Now, the WHO has their recommendation, and Nigeria has fallen short.
When you say the top, you're talking about the federal government.
Yes.
The federal government's budget for health is low.
Generally, very low. And then the universal health coverage, health insurance, because what we still practice in Nigeria is out-of-pocket payment. So when the patient comes to the hospital, you bring the money out of your pocket. Now, we need a situation where the health insurance in Nigeria, we have over 70%. What we have now is less than 30%, which is abysmal for us. Even, we are not talking of a country in Europe, or when we go to West Africa, a country like Ghana, for instance, have health coverage of over 70%. So a situation where Nigerians have to pay out of pocket, and you imagine a patient that is in coma, knocked down by a vehicle, you now ask them to pay money at the point at which you want to treat them. So these are some of the problems. So the problem is both from the top and also in the hospital itself. I believe that even with the resources available, we need to prioritize and do things in the interest of the common masses.
How do you want the hospital to prioritize to accommodate people who are in emergency wards or who have very serious diseases or sickness?
Yes, sir. One of the priorities is that, you see, we are talking of basic facilities. We want basic facilities to be available. For instance, when you bring a patient to the emergency, what type of bed are you using? How many beds do you have there? When you go to the wards, some of the beds there, they are as old as when the hospital was established. And
In the 60s.
yes, sometimes you may not even have enough bed spread, you know. So there are issues like that. So we want the hospital management to focus on basic. We want a situation where in an hospital there will be constant water supply.
But some people said that the problem of water supply was because the staff, especially the health workers, who are supposed to make sure that these things work, because they were on strike, that's why the state of the toilets and bathroom looked like that, because they weren't cleaning them for that duration.
Okay.
Okay, maybe we should get you to quickly respond to that.
The truth is that that cannot be correct. Yeah, the truth is that people who do the cleaning have been outsourced, and the current people doing cleaning are contracts. They are contract staff.
So they're not part of the strike.
They are not part of the strike. So that cannot be the situation. And the issue of the state of things in the hospital, like you were asking, is not something we just started talking about today. We've been on it. It's a recurrent decimal. We've talked over and over. We've written, and it's like we are just fooling ourselves. And that's why this action we are on is not issue about money or things like that. It's much more issue about the patient,
Facilities.
the training, the objective of the hospital. I mean, our hospital is a social welfare institution. It's not an institution for profit venture. But in a situation whereby everything is shifting towards profit, though when we challenge our management, they will say they are owing suppliers, they are owing this, they are owing that. But what about us running a revolving fund system? If we do that, we will know that from what we make, we need to save to make to reinvest to be able to sustain the system. But what we hear is that the financial policy does not allow revolving fund. But I know, like laboratory in UCH, Obafemi Awolowo University, even in Ilorin, they are running revolving fund, and they are being sustained. At least their laboratory services work much better than our own. And other service area, if we have revolving fund, we'll be able to recoup the money and we'll be able to sustain. And to me, if we do that, it will go a long way to help us.
Okay, now let me just find out. Now, we've talked about what the issues are, all the problems that's being highlighted, both in the report on what yourself and the president of the Resident Doctors Association, you've tabled a lot of issues. We did gather last night that the Minister for Labor has been within the University Teaching Hospital helping to mediate and to help resolve the issues. What is the status of the conversation at the moment?
Okay, well, yesterday we were in Ministry of Labor and Productivity. They invited us for a mediation meeting, and it was okay. I think we are talking better. We are getting some more promises that this and that will be done. We also got a promise from our chief executive yesterday that they are working on bringing down the prices. Am I correct?
Yes.
Or is it that they said they have brought us some memo that
yes,
prices of certain, cost of certain treatment, especially surgery, that they are coming down? Well, we hope, we are yet to see, but we hope to see it. We believe in.
Okay.
And
So in the light of this, in the light of your discussions
we
yesterday.
We have called for an emergency meeting for tomorrow, where we are going to brief our members, because we are not leading on our own, we are on people's mandates, and we are going to have meeting with our members tomorrow. And then we also reached an agreement yesterday that by Tuesday, I think, was it 9 or 10, we agreed that we should have a communique. I believe that communique is an agreement between two parties. So we are going to have all the points that we have agreed, and that we have agreed that will be addressed immediately. We are going to have them in black and white. And then those that we are going to be looking at for a certain time frame, I believe all that will be in the communique, and since it